So at that stage, in the early 90s, some discussions started about a proper organised after-hours service. And that process took about 3 years. Well, it was 94, 95, wasn't it? So yeah, it would have been 5 years altogether.
It was because Larry was pursuing all his compatriots, of whom there were 29 by this stage.
Doctors in general and GPs in particular are...
They're not collegial. They're all alpha personalities.
That's right.
And nobody wanted
right.
to be
Compromise is not in their vocabulary.
That's right. And right till the last signing up the night before, one of them was still skittering off and they needed all 29 in. And people have said, Larry, what he did was an absolute masterpiece of cajolery and compliments and a bit of a stick, and he just kept at it and wasn't going to give it up. But it was quite remarkable to watch.
So having kind of started that whole process off, I felt an obligation to take it to a conclusion. And we did. We got it built. Vic Alcock was really helpful in the latter parts of the project. He sort of took over as building project manager, and we leased the premises that we had for 10 years down in Hartham Place, which is where the medical laboratory is. The medical laboratory was actually already in that building. They had far more space than they needed, so we did a deal with them. They would use it during the daytime, but we would refit it so that it would be an after-hours clinic. And all the doctors took turns, and it was a much less onerous situation, and we were able to employ a few extra locums as well. And so that ran all night from 5 p.m. to 8 the next morning, weekdays, and throughout the whole weekend, 48 hours, for about 10 years. Until 2004-2005, which was when, due to external political circumstances, the Accident and Medical Clinic was established at Kenepuru. Annette King, who I greatly admire, but this was one decision which was a bad one of hers, had promised the people of Porirua they would have an emergency department when the decision was made to build the new regional hospital at Newtown, not much more sensibly out here. Little did she know that you can't build an emergency department without a proper full-sized hospital sitting behind it. So what they got instead was an accident and medical centre, and some people still think of it as an emergency department, which is not. Then there was Kenepuru coming up, and there was our nice, sweetly running little wee after-hours centre, and they were clearly duplicating each other. So then began another really painful political process of negotiating an amalgamation between those two.
Larry nearly died organising it because there'd been negotiations for about 5 years that he was involved in, and it was coming right down to the wire, and he'd been up all night going through all the contracts, and he went from the practice and he rang me and said, I've had an accident, I've been hit by a truck, I'm okay, but the car's written off. And I said, are you really okay? Yes, he was okay. So I went down, and it was just the tower on-ramp, big truck had come and clipped him. Anyway, I looked at the car, which was a write-off, and the meeting was in half an hour. And I said, look, you've gone through all this. Why don't you go to the meeting anyway? Well, he was grey. He just looked terrible. No, I said, come on, I'll take you. So I rang them up and said, look, I am coming. He'd already said, I'm not coming because of the accident. And they said, are you sure? Oh, yes, he was sure. So and he went. And he got the most fantastic terms, much better
That's right.
than he would have otherwise. And I went round the road and cried, and everyone said, Anna, it's just, I mean, she made him go to that meeting. And I thought actually it was better for shock that he didn't dwell on it.
Yeah, that was a bit scary, to say the least. Yeah, great big, huge, double trailer rig, and just caught the front of my car, which then swung around, and my car was here and the truck was there, and we just skidded down the highway for about 100 metres or so before coming to a halt. And I'm sitting there in the driver's seat, and this truck driver is up there. He can't see me. He knows something's happened, but he can't see me. So around about the time as well as the whole negotiation for the Kenepuru A&M clinic and the after-hours clinic was going on, I was obviously dealing with and getting to know a lot of the hospital management. And this was also, in the early 2000s, the beginning of primary health organisations. So that was Annette King's baby again, when that Labour government did a really major refresh and invested a lot of money, which was very welcome at the time, because towards the tail end of the 1990s, particularly in situations like ours, the viability and the kind of living that could be made out of general practice was looking less and less good all the time, and people were canning out. In the late 90s, we talked about WEPA before, the Wellington Independent Practice Association had started, and that was, quote, organised general practice, and had been sort of a response to some of the need and the opportunities for doing some contracting on a larger scale. So the old school thing was every individual doctor had an individual contract with the Ministry of Health, and you'd fill out these schedules. Every patient you saw, you'd write their name and their address down, and you'd tick a box that said what sort of consultation they'd had, and then you'd get X number of cents for that consultation from the government, and maybe some money from the patient as well.
And that applied for everything. So you had maternity, the general practice subsidy, ACC, all these carbon sheets that you filled in and
all
added
handwritten and submitted to the Ministry of Health.
But sometimes when things were really dire and the bank manager was being unkind, the payment would be late. We got paid on Tuesdays, and for a while it was dodgy. And I had this ghastly woman from Westpac who would ring me on a Monday to rake me over the coals about the overdraft, and I would say to her again and again, we get our big payment on a Tuesday, but sometimes if it didn't come, there'd be a lot of sleepless nights.
So the WEPA, the Wellington IPA, it was started up in Wellington. Richard Tyler from Johnsonville was one of the early instigators of that, and he led the organisation for a long time. And we joined because, again, it was obvious that we couldn't not computerised thereafter because of data collection. But they started to do some interesting contracts with managing medical tests and so forth and saving money, and then using the money for other good stuff. And then WEPA morphed itself into the new PHOs, which Annette King was setting up, which was a model where there would be this kind of organised general practice, and they'd be in partnership with the then area health boards, and there'd be some community involvement and governance as well, and they'd have boards of trustees, a bit like school trustee boards, with that kind of structure. And initially there were 3 of them, one in metropolitan Wellington, one out here in Porirua, which is known as Tumai, and one up in Kapiti. So I got involved in that. It kind of seemed inevitable, really, because of all the other things that had been happening. And one of the things I learned as I went along is that this kind of organised stuff, most of my colleagues were either not interested or pretty hopeless. And a lot of the hospital management also pretty ignorant or pretty hopeless. And increasingly my feeling was, well, we've got to keep the idiots from messing it up, so somebody who thinks they've got some common sense better stay involved. So I did, and continue to this day.
Chaired Tumai.
Yeah, chaired Tumai for about a decade.
And then it amalgamated into this really big organisation that runs everything from the Wairarapa up to Kapiti, covers that whole area, and Larry chairs that.
So those 3 PHOs amalgamated 2008, maybe, thereabouts, and became known as Compass Health, which is the sort of broader PHO that Anna's talking about. And I've been involved in the governance of that all the way through, and I've been chairing it for the last 4 years. Yeah. And it's just actually gone through a rebrand, so it's now adopted a new Maori identity and is known as Tu Ora Compass Health. We had a big Matariki celebration last Friday.
What you're telling me is that the doctoring has become much more political and much more client or administrative or...
Well, that's as well as, it's not instead of. The doctoring work, the clinical work, has gone on unabated.
Yes.
All
But where you were getting up at night to go and deliver babies...
Now I'm staying up at night reading contracts.
Yes,
yeah, that's right.
That's right. And you knew families intimately.
Yeah.
You're now completely au fait with policy documents.
Yeah, that's right. I mean, it's always seemed to me to be part of the deal, really. It's think about it in the sense of kind of advocacy.
Though interestingly, I would say that all of this shift and change in far more accountability and compliance is what drove Larry out of solo general practice. It simply became unsustainable in terms of compliance and auditing and reporting, and a full day of work as well. And we did this ghastly thing called Cornerstone, which has a series of indicators that you must fulfill. 31 of them, I think. Everything from health and safety to staff relationships. And we did it, and it's very expensive to do. Each thing costs, and the whole process actually costs you to do, but you have to do it. And that was our last year, and we really were stretched to the maximum, both of us doing it. It was exhausting, and we were working at night and trying to get it up to scratch, and we passed with flying colours, and I think we were the only practice ever to pass on first go, and we did it that day, which was fantastic. And the guy who did the main assessment, he said, if I could take this and make every practice in New Zealand like this, I would. You've got it absolutely covered. And he was a national coordinator and advisor. And he said, I'd walked up the road thinking, oh, I'm going up to this hole-in-the-wall single practice, some old guy who's still in the 1800s. And he said, I come into this extraordinary place which has everything I believe about general practice. It was wonderful, but it just about killed us. And we got offered the Whitby possibility that week, and we wouldn't even have looked at it 2 years before, would we?
No, it's just the right time.
Let's give some other poor bugger all this dreadful administration, and you can actually get on with what you like doing. So we did 34 solo years.
And now you're in Whitby,
Mm-hmm.
and it's okay?
Yeah, yeah. Some things have been lost, obviously, so some of the really close-up and personal one-on-one stuff has been lost, and there's a proportion of my old group of patients, not very many, I must say, it's been gratifying that it's not been a big number, who either couldn't come to Whitby or tried it out for a while and then decided it was too far and too hard. But the vast majority of the families and the patients that I've looked after have remained loyal, and they still come.
Well, we had 1,800 and something, didn't we?
Yeah.
And after 2 years, we still had 1,700 of the original. We've got 2 old ladies, one of whom drives, and they decided they would keep coming, but they'd come together. So we have to coordinate all their appointments because one drives the other. They say, you know, when one of them stops driving, they'll have to think about it, but they make an outing out of it, and they come and have coffee at Whitby.
There's a nice flavour at Whitby too, because one of the other senior partners there, whose name I mentioned earlier, David Robinson, started off in Waitangarua, as I said. So he's got quite a substantial connection with the whole of Eastern Porirua and all of the social characteristics of it as well. And he's had the same experience. He's got these lovely family who's come over from Waitangarua and from Cannons Creek, big sprawling Maori families, come over to see Dr. Dave, and it's great. It's great. So, you know, in the sometimes slightly prissy suburb of Whitby, it's less now than it used to be. You get all of this robustness coming in as well, the sort of thing that we always enjoyed right from the word go.
So no regrets about your great shift from Wadestown to Porirua?
No. If I think back now, I mean, it's interesting because we came very close to moving into a practice at Island Bay. And then and now, the Island Bay practice is one that I admire. It's always been something a little bit more special than the average run-of-the-mill. And that came close to coming about, actually. And then at the last minute, they got the jitters because they were being progressive, and they said, no, we need more gender equity, and we've got too many men, we need a woman. I said, sorry, Larry, we'd love to have you, but you're not that. And they did come back years later saying, oh, we regret that.
Well, she only lasted 6 months.
That's right.
But by then we'd done the move, and
Yeah.
I regret it sometimes because where we lived in Wadestown, I was incredibly happy, and I loved our cottage. It's just gorgeous.
But then this house is fabulous.
Yeah, it is.
Yeah.